DocTalk is brought to you by Merck Animal Health, the science of healthier animals.
Hi there and welcome to DocTalk. We're sure glad you joined us today. We're going to have a great show. We're going to talk about pink eye in cattle. My guest today is Dr. Matt Miesner, and he's an associate clinical professor here at the Veterinary Health Center at Kansas State University's College of Veterinary Medicine. It's bound to be a great show. Stay tuned.
As dependable as the sunrise, in dairy parlors, open pastures, on ranches and feed yards across America. A place where reputation is more than a name, where the science of healthier animals is a way of life. It's the responsibility that drives who we are and what we do. Every decision, every day. It's your livelihood and our responsibility.
Closed caption brought to you by AgriLabs, the perfect pairing of performance and value.
This segment brought to you by the new Hired Hand Portable Cow Sprayer. For more information, visit cowsprayer.com.
Matt, welcome to the show.
Glad to be here again.
Well, it's always a pleasure to have you here. And folks, Dr. Matt Miesner is a associate clinical professor here at the Veterinary Health Center, and he is boarded in large animal internal medicine. And Matt, we're going to talk about something that's very common in cattle. It's something we see every summer, pink eye.
Right.
And let's start out discussing, what are some of the things that causes pink eye?
Sure, that's kind of, as we discussed before, it's kind of becoming a hot topic about this time of year is pink eyes and problems with cattle in their eye. And pink eye is probably one of the more common ones that we see, and it's an infectious problem of the eye. And actually, there are some specific bacteria that we talk about that cause the infection. But what we find is that we have a lot of other players in the environment that come in to aid them bugs. And this time of year, those things are coming about. Sunshine and dust and things like that.
It's kind of like when we talk to students, tell them there's two reasons animals get sick, either an overwhelming dose of a pathogen or a suppressed immune system. And
yeah.
This is really one of those that is an example of that.
Exactly. Yeah. I mean, in the specific bugs that we talk about causing it, one being the Moraxella bovis, and you'll see that in a lot of vaccines and whatnot. We'll see that bug, and it can cause problems, but it usually needs something to help it get a toehold, and something disrupts the eye or their immune system's poor, and then all of a sudden we start to see this type of infection show up, and it can be pretty devastating and just run wild through a herd.
So when we start to talk about some of the different things that, we talk about Moraxella bovis and some of the infectious agents, what are some of the non-infectious agents that can help set up pink eye or cause something like pink eye?
Irritants. So an irritant such as dust, grass-awns, sometimes composted bedding, sunlight, anything to irritate the surface of the eye or that cornea allows that bacteria that sometimes can be on the eye normally just grab a toehold and then cause this horrendous infection.
What about flies?
Flies. Yeah, flies are irritating. Not only do they disrupt the eye and scratch it up, but then they'll grab it and go right straight to the next one, so they can carry the...
They can carry. Yeah. And we see that with foodborne pathogens like E. coli with flies transmission, and so...
Right.
So they could actually carry the bacteria from one animal to the other.
Yeah, that's probably some of the way we get these massive spreads through a herd when we have an outbreak is flies and fly control. And they're irritating, and they're just nasty little bugs.
Yeah. Well, I think it's important to understand the bugs. I think it's important to understand the irritants. When we come back from the break, let's jump in and start talking about how we diagnose some of these problems and move forward with pink eye.
Great.
You're watching Doc Talk. We're glad you joined us. We'll be back in a moment.
This Meet the Future Veterinarian is brought to you by Zuprevo. Choose confidence. Choose Zuprevo for BRD treatment. Laura Bro grew up in Montour, Iowa on a cow-calf, feedlot, and crop farm. She became interested in veterinary medicine first through her work with her family's animals, and then also by working and shadowing in local veterinary clinics. After graduation, Laura hopes to find a job in a mixed animal practice or working exclusively with cattle.
Some call it a come-from-behind victory, an unlikely win, a reversal of fortune, snatching victory from the jaws of defeat. This is our moment, our victory dance, because we choose confidence. We choose Zuprevo for BRD treatment. Ask your veterinarian to prescribe Zuprevo. Zuprevo is a fast-acting, long-lasting BRD treatment that you can count on to get the job done. Choose confidence. Choose Zuprevo from Merck Animal Health.
Horn flies are a nuisance and a production loss, so getting rid of the problem is important. What I like about the Vet Gun is you don't have to go out there weekly to treat them with a topical fly applicant. It has some duration, it lasts. You see the increase in weight gain, it just works. I've used it on our 1,500 cow-calf operation, and it makes me more confident in saying, hey, this product's gonna work on your operation too.
This hog is Hanover hoof for meal made from U.S. soybeans. Now, one hog isn't that impressive, but suppose we add another, and another, and another. Before long, you've got billions of hungry customers around the world all clamoring for the same thing. Our soybeans. Learn more about the billion-dollar appetite of animal agriculture at BeyondTheElevator.com. Brought to you by America's soybean farmers and their checkoff.
Through the generosity of Dr. Eva Gardner and Dr. Dan Thompson, Kansans now have the opportunity to support the wildfire relief effort by purchasing a signed and numbered print of the original painting, A Walk Through Henry's Dreams, by Dr. Gardner. This gallery quality print is only $200. Order your print today online or call 785-273-5115. Please help support the Kansas Livestock Foundation Wildfire Relief Fund.
This segment brought to you by the new Hired Hand Portable Cow Sprayer. For more information, visit cowsprayer.com.
Welcome back to Doc Talk. Dr. Dan Thompson here from the College of Veterinary Medicine at Kansas State University, and I'm joined by Dr. Matt Miesner, who is an associate clinical professor here at the Veterinary Health Center, and he's also a boarded large animal internal medicine specialist. And Matt, we're talking about what causes pink eye. Now let's get back to, and a lot of people can diagnose or have seen pink eye cases, but let's go through what you see as kind of the clinical signs first of pink eye and different levels of severity.
Well, and we certainly see a lot of cattle sent in with a white eye that may or may not turn out to be pink eye, but the biggest thing about pink eyes, we'll see these kind of very nice centered looking like scars right in the middle of the eye, and they really rapidly spread. The big thing about pink eyes is very painful, so they're tearing a lot, and there's a lot of watering eyes and squinting and trying to stay out of the sun. And then it'll get to where it almost looks kind of abscessed or infected, where you have this kind of white area that kind of spreads across the eye. The surrounding portion of that eye just gets really irritated and angry, and it's very painful. And so at that point, did we get a sticker in it? And there's still a sticker in it.
Right.
Or are we dealing with a pink eye problem that could be an outbreak or kind of some situation that we would do?
You see how these cases can manifest, and some of them get a little bitty scar, and some of them get that pop eye, and how is there anything to the severity? Is it more of a calf by calf situation, or?
I think you get back to where we talked about before. We get overwhelming dose and individual immune system, and so a lot of their immunity to fight this thing off is in their tears, and some have a more specific immunity to that bug, and these bugs can change rapidly even within an outbreak, to where that immunity that's on that individual calf may not be totally effective, and so we'll see some of them that just have massive infections, and others seem to be status quo for a little bit longer. But yeah, there's quite a bit of individual variation.
And we always recommend people work with their local practitioner. What are some of the things practitioners might do to get a better diagnosis of what's going on? Maybe of course we do the clinical exam and the physical exam, but what are some things diagnostically that we might do?
Well, if we're looking for a specific bug, they can culture it. We can take swabs, we can send them to the diagnostic lab, and they can tell us what bacteria, what bug is there, and is it one of these that are pink eye bugs. But I always tell people too to really, every single one that we swab, take your finger and sweep it through the back of the eye and look for grass-ons.
Yeah.
So that's part of the diagnosis is, we're going to find a bug, but we're also going to try to make some other management tools to prevent the risk factors. And so, hey, we got a bunch of grass-ons. We better get these things out, and then we'll figure out what bug we got. So, yeah, a bunch of different ways to do that.
So it can be, what are some of the other differentials that might be on your list?
Oh, we've seen viral things like IVRs and BVDs and, just overall traumas. And in older cattle, we might see some that think they're cancerized or different situations, some odd situations. And I've seen white eyes where they were just bacterial infections in the eye. And they weren't an eye infection. So there's several different things it could be, but it's pretty
clear.
Yeah, it's pretty clear for the most part.
When we come back from the break, we're going to talk with Dr. Miesner more, and we're going to talk about how to treat those pink eye cases. You're watching Doc Talk. We're glad you joined us, and we'll see you in a minute.
The BQA Tip of the Day, sponsored by Beringer Engelheim Vetmedica, Inc.
I'm Dr. Kip Lukasevich with Production Animal Consultation. Today's BQA Tip of the Day is proper storage of micronutrients. So today at the feed yard we're at, what we have here is we have our micro ingredients such as rumensin, our Thailand in the feed, our micro minerals such as Vela-4 and so forth that are going to go into the micro machine. We just have to understand that when we store these ingredients is that we never store them next to insecticides or other chemicals that are not to be in the feed. These things have to be stored by themselves and in an area that is dry, temperature sensitive, and has humidity control as well. When we feed these things or put these things into the micro machine, just make sure from a safety standpoint that we utilize dust masks, gloves, so we don't get them on our skin, because sometimes they can be very sensitive, as well as just inhaling the product because they are very small in size and the dust can get into your lungs and so forth. So just use dust masks, use gloves, and then always store them properly.
It must be an inherited trait because I have never wanted to do anything other than be in the cattle business. And it's interesting as I have grandchildren now, little bitty ones. All they want to do is go to the barn, swing a rope, and be a cowboy. It's something. It's a lifestyle that we have, the way we make a living, obviously. But it's really more than that. It gives us the opportunity as a family to be able to work together and enjoy each other's company and make a living at the same time. We've been using Triangle for years, and the reason we do it's been safe and effective, and we're going to continue to do that. We'll put the cows in the chute twice a year, spring and fall. 100% of our cattle get vaccinated with Triangle.
Broadband has become as important to us as highways. That is why DocTalk is teaming up with NTCA, the Rural Broadband Association, and rural broadband companies like Blue Valley Telecommunications in fighting for quality broadband access through the program Smart Rural Communities.
I don't think we have any idea what's coming in the future. I couldn't have imagined 5 years ago what we're doing today. So in 2 years, I would guess there's things we can't imagine that we're going to be doing.
To learn more, visit ntca.org/smart or bluevalley.net. Valley Vet Supply is devoted to providing information and professional quality products at reasonable prices.
Valley Vet Supply.
This segment is brought to you by the Beef Quality Assurance Program and the Kansas Beef Council, improving animal care and beef safety for more than 20 years.
Hi there and welcome back to Doc Talk. Dr. Dan Thompson here with Dr. Matt Miesner. And Dr. Miesner is a boarded large animal internal medicine specialist here at the Veterinary Health Center. He's also an associate clinical professor at Kansas State University. We've been talking about pink eye, and we're going to talk about treatment. And before we jump into it, the one thing we always recommend on Doc Talk is that they have a valid veterinary client-patient relationship and that they work with their veterinarian to get a proper diagnosis and plan of attack on treatments. Because as we discussed during the break, there's more than one way to skin a cat on pink eye treatment.
Absolutely, yeah. And I don't really think there's a wrong way to treat them. I think that you're going to find several different methods, and what works for your veterinarian works for your veterinarian because it's worked for your veterinarian. So
right.
If that's where we want to go, we can stay up with current thoughts and current trends on bugs and antibiotic sensitivities, and whenever they get that chance to culture and do a sensitivity, they might pick a specific antibiotic this time, whereas they might pick another one the next time. Just depends what they're going to do. It's nice to have that, but so an antibiotic is one of those things that we like to have direction on, but we don't always, so we may just kind of randomly pick one initially and see if it's going to work. Next thing, I've seen procedures where the biggest thing is getting them out of the sun, protecting that eye. It hurts as long as that sun's beating on them, so we may glue a patch on.
Get the irritants, the sun, the flies, the dust, get it off of there.
Protect them. So I've seen patch glued on. I mean, there was a time when I was cutting out old Levi's to make patches that we could glue on the eye. It also prevents flies from getting on that and going to the next one. I've seen other situations where we're injecting penicillin near around the eye and then covering it with a suture. So that's another method that you might have seen, or any of the people out there might have seen their veterinarians do. Depends on facilities, what you have to work with, where you're at, and how you're going to treat those. But it's nice to get on it and have a direction and stick with it, and make some scientific choices through the course.
Any preference for you, systemic versus the localized injection of antibiotics?
Well, everything that I've read has shown that either a systemic antibiotic, there's a couple mentioned, or the locals, the duration of the disease is about the same. And most of the big studies looking at overall cure rates and time, they're all about the same. One thing I do advocate is an anti-inflammatory, though, because those eyes hurt.
What would be some examples of anti-inflammatories that you?
Flunixin, Banamine, and I've even seen dexamethasone or steroids used, depending on how bad they are.
Just to help with the pain of the eye and reduce the inflammation around that cornea.
Right, and some of them get bad enough that they get beyond treatment, and then at that point it's probably a good idea to take the eye out. So we've had to go that far too.
So antibiotic, systemic or local, get an anti-inflammatory, and if it gets bad enough, we may have to remove the eye.
Right. Yep.
Great. We're going to take a break. When we come back from the break, we're going to talk about ways to prevent pink eye from occurring in your herd. Dr. Matt Miesner has joined me today. You're watching Doc Talk. We're sure glad you joined us. We'll be back in a minute.
When looking at the number of farm and ranch operations, the USDA Census of Agriculture says cattle and beef production is the largest single segment of American agriculture. The census also says the average age of the American cattle farmer or rancher is in the late 50s. In order to support the continuous supply of U.S. beef, these producers need to do some business planning to successfully transfer their cattle operations to younger, independent producers.
My name is Sam Hands. I'm part of the operation here south of Garden City, Kansas, known as Triangle H. Our operation starts with an irrigated farming operation and also involves cow-calf as well as farm feedlot. So obviously the beef industry is very important to us as a marketing tool of those products grown on our irrigated farm. I feel especially privileged not only to be a part of the beef industry, but to have had the opportunity to be one of the original 6 delegates from the state of Kansas as the beef checkoff system was established back in 1986. And as I reminisce back at that times back there in the early meetings in the mid-80s and the early 90s, to me it was very humbling and gratifying to see all segments of the industry come together with a common goal, and that was to advance the sustainability of the beef industry and by way of a product that was going to bring satisfaction to our consumer.
Hi, I'm Marissa Kleistuper, and ever since I was a little girl, I have always known that I wanted to grow up and work alongside my dad. He has been my hero since I can remember, and got the opportunity to come back home and work alongside my dad on a daily basis and learn from him and watch the family operation continue to grow. And the other best part of my day is my two boys get to come alongside and work with us and learn from my dad as well.
But more than anything, as I look at this whole program, is what it's allowed us to do as a sustainable program in the beef industry, and has allowed us to bring future generations into the operation in order that the beef industry might be sustainable for the future. My pride and my pleasure to have my daughter and her children to be part of our company here as Triangle H. Thank you.
Healthy cows start with the new hired hand automatic livestock sprayer. Rancher invented to provide an efficient alternative to pour-on and injectable parasite management systems. The portable design allows cattle to treat themselves head to hoof. Strategic device placement with pass-through activation technology takes the stress out of parasite treatment for cattle and the rancher, leaving more time to tend to other vital tasks on the farm. To learn more, visit cowsprayer.com. The new hired hand makes healthy cows easy.
Hello friends, I'm Ernie Rodina.
And I'm Dawn Dawson with the Better Horses Radio Show.
For over 9 years, we've been bringing the Better Horses Radio Show to markets all across the Midwest. We talk about God, lots about horses.
We talk about cows, we talk about horse health, we talk to top trainers, and we even talk about Roy Rogers.
We're having a blast with Better Horses Radio Show and would love to take it to a market near you.
So visit our website at betterhorsesradio.com and let us or your local radio station know you'd like to hear it in your area.
The Better Horses Radio Show is unbelievable.
This segment is brought to you by the Beef Quality Assurance Program and the Kansas Beef Council, improving animal care and beef safety for more than 20 years.
Hi there, folks. Welcome back to DocTalk. Dr. Dan Thompson here with Dr. Matt Miesner from the Veterinary Health Center. He's a boarded large animal internal medicine specialist, and he is an associate clinical professor. And we have been talking about pink eye, and it's something that happens in all the cow herds, and we've gone through the causes, the bugs, the ways to diagnose it, treatments, and now we're going to talk about prevention. And I told Matt during the break, I said, we better start out with vaccine because that's the one everybody's going to want to know about right off the bat. And what are some of the general thoughts or opinions on vaccinations?
I think that the general thoughts is, they wouldn't be there if they didn't have some benefit, and I believe they do. And then there's also the vaccines we have that we can culture that bug. You can send it into a lab and have that bug made into a vaccine, meaning an autogenous vaccine. And I've heard all of those used. And then on my side, I kind of look at the evidence and try to figure out, is it a cure-all? No, it's one of these bugs that can change so readily within an outbreak from year to year, from herd to herd. There's a couple of different bugs that they're actually questioning now. So it's pretty wide. It can help. I think what we've pretty much consensus is if you use your vaccine and it's not really cutting the mustard, you might spend more of that money on some other preventive measures, which we get into secondly. But the vaccines, they're there. They're a good tool. Use them if they're not working. Then we need to kind of focus on the other 5 or 6 different problems that
might make a little bigger difference.
Because treatment is a nightmare. It's one of those, when you get into a big mess, it is a lot of labor and a lot of work and a lot of frustration. So prevention is the big key here.
What are some of the other, we talked about the irritants. What are some of the other things that we might do to kind of prevent?
Sure. So, the irritants being grass-awns and dust. So we can limit dust by, if we have the ability to keep moisture on the ground in pens. We can mow the seed heads off the pastures to limit all the grass-awns that could get in there and irritate the eye. We can have shades just to keep that under control. UV light, fly tags, different things, fly preventions. Those are huge. And if we can get all those added up in an efficient way, I think we can limit it a lot. I have clients that will start mowing pastures here to limit their exposure and kind of irritants for pink eye. They've had it in the past, and that's one thing that works to limit it. And so.
Well, I've even seen some deals on fly control that'll be coming out that fly control delivered in a paintball gun.
Oh,
yeah. Yeah. So
that'd be
could
cool.
be kind of fun
Sure.
way to get rid of flies in here. But,
And then lastly, I think good nutrition. Good strong nutrition, keep them healthy, keep their immune system going. Trace minerals and overall energy. I think we'll keep them healthy.
Well, appreciate you being here today.
Sure.
Appreciate you joining us too. If you want to know more about what we do on DocTalk, you can find us on the web at www.doctalktv.com. I'm Dr. Dan Thompson here from the College of Veterinary Medicine at Kansas State University. You've joined me today on DocTalk. We're sure glad that you did, and I'll see you down the road.
Closed caption brought to you by AgriLabs, the perfect pairing of performance and value.
For more information about this program or previous programs, go to DocTalkTV.com. DocTalk was brought to you by Merck Animal Health, the science of healthier animals.